Hi everyone, and welcome to the first Creating Careers of 2022. So thank you all for joining us. We've got 3 topics that we're going to cover today. It's a really packed schedule, so I'll get through it as quickly as I can. Just a reminder of the usual housekeeping. Please do keep your cameras and mics off. The session's being recorded, so if you don't want to appear on that. And then you should have a chat box either at the top of your screen or at the side of your screen, depending on your Zoom setup. Any questions that you've got for ourselves or any of our speakers, just pop them in there and we're really happy to help you out with that as well. We are going to be starting off with an information session from Leslie-Ann based on the pre-work that you'll have received from my colleague Abby, and then we're going to really kind of fire through the different interviews. You're being supported today by lots of different NHS trusts and also the local Uni Connects in your region. I don't know if the Uni Connects want to just say hello in the chat so everybody knows who they are. And we just wanted to take a second to draw your attention to the Google Classroom. You will have seen this mentioned in your pre-work email, but we just wanted to make sure you're really aware that it's there. Everything that's covered in here goes on it, and the links to the recordings and lots of other really useful resources that are provided by everybody supporting this event. You've also got the chance to get extra help and support through the Google Classroom, so we really do recommend that you join it. We'll pop some joining instructions in the chat in a second, but we'll also, after this event, we'll add you all on, so you will receive an email and you can click to join in there. But if you wanted to look through any of it before you get that, we'll just pop those in, and it's really, really simple to do. You can do it on whichever device you're using, whether that's laptop, tablet, or your phone, or whether you're using anything connected to kind of a big screen like your games console. Okay, I think that's everything for me, so I will stop my screen share and hand over to Leslie-Ann.
Hello everyone, we're going to start the Creating Careers pre-work quiz. If I'll just share my screen and get all that up for you. One moment while I start that up. Okay, brilliant. So we thought we'd host today's session a little bit differently. At the beginning of every Creating Careers episode, we do a pre-work quiz that focuses on the job roles that are featured within the episode. So today, rather than focus on the specific job roles, we're going to look at NHS values. Now, the reason why we do this pre-work is to make sure, so before every episode, you get sent an email from Abby asking you to complete some pre-work to make sure you are as prepared as possible for the session. Now, we want to start off each session with this pre-work quiz to make sure you get as much feedback as possible from that pre-work, make sure you've understood it, and gives you an opportunity to ask any questions about it if you so wish to do. Now, what we're going to do is we're going to get a little bit interactive. Now, I ask you to get as involved as possible. So your mic's off, your camera's off. Half of you have got usernames that I couldn't even read out in the weeks gone by. So you've got nothing to lose by giving it a go, sharing your opinions, sharing your answers within the chat. The more you get involved, the more someone else will get involved, the better the session is. We all help each other with each other's opinions. So it's not a test at all. There's no scoring. So you've got nothing to lose and everything to gain. Get involved. So what we're going to do then is we're going to start off. So the first thing I want to talk to you about is values-based recruitment. And we're going to kick off the year with just a slightly different angle, like I said earlier, and we're just going to focus on the values of the NHS. If you want a job within the NHS, any role at all, or you want to apply for a course within the NHS, you need to show you share the same values as the NHS in your application, and this is called values-based recruitment. So the NHS doesn't recruit using the traditional CV method. It again uses value-based recruitment. In your application, every candidate, or you yourself if you're applying, you have to give examples to show your personal and professional values match the values of the NHS. Now, before we look at the values, for some of you, this will just be revision who've been on previous episodes. For some of you who are new to it, this may help you out. In the chat to warm up, come on, let's get nice and involved. What do I mean by the word value? Even if you just say a keyword that you think of when you hear the word value, I'm talking about the NHS values. What do I mean by the word value? Think carefully. What, any keywords that come to your mind? Come on, someone must have an idea of what they think a value might mean. warm up. Okay, thank you, Matthew. I appreciate that hugely. What you can give to the NHS, brilliant. So it's something like what you've got to offer, what's important to you, what you think. Thank you, it's all coming now. Characteristics, rules, fantastic, really appreciate it. So to put it in simple terms, that's all absolutely brilliant. Values, a belief of how you should behave. So we're thinking in your application, you're showing to the NHS, you feel your beliefs of how you should behave in your professional and personal life are the same as theirs. So in your pre-work, you will have given all these values and you were asked to think about how you can show the values. So for those, I'm just going to go with a very quick recap. What I would suggest is that you take a picture of this just on your phone so you've got them at hand to look at throughout the rest of the session. So just take a quick picture so you know what the NHS values are. So just because I've asked you to go through these before in the pre-work, I'm not going to spend loads of time on them, but just for those who may not have been able to do that pre-work, first value we've got is working together for patients. So patients come first, but it's really important to give them the best quality of care. You work together with lots of different stakeholders. So the patient themselves, staff, families, carers, communities, professionals, maybe inside and outside the NHS, and that you all work together and you speak up when things are wrong, and obviously celebrate when things are going right. So the next one, respect and dignity. We're treating everyone with respect and dignity, not just the patients, very important for the patients, but all those stakeholders, again, that you're working with, family, staff, individuals in and out of the NHS. So you'll see how these values all link together. So you show respect and dignity. You recognise that people have some limitations, people have different abilities, different priorities, and if you disagree with someone about something, you do it with respect and dignity. You disagree respectfully. Okay, next one, everyone counts. Okay, everyone counts. No one is discriminated against, no one is excluded or left behind. Different people have different needs. They respond differently to things. Some people take longer, some people are quicker at things. We recognise that and appreciate and value that. Okay. Next one, commitment to quality of care, right? So you are committed to giving patients the best experience that you possibly can. And with that comes asking for feedback from all those people you're working with, again, asking for feedback on what you are delivering to your patients and using that to improve, to give the best quality you can, showing your commitment. Okay, compassion. So making sure you show that you can feel, you're feeling for the patients and their families and people you're working with, and you are doing your best to comfort them, showing them kindness when they're feeling pain, distress, anxiety, and you are doing everything you can to make that situation better. And what's really important, you are doing that without being asked. You're not sitting around waiting for someone to go, you need to show a bit of compassion and make this person more comfortable. You're doing it because you feel it and you want to make that person's experience better. Okay, and lastly, improving people's lives. If you work within the NHS, you have to show you're committed to improving people's lives. You want to show excellence and professionalism in everything that you do to help improve lives, and not just the patients on their own, but your community. Okay, so there they are in a whirlwind tour. So why is this important? At your point, at your stage now, you probably haven't got hands-on experience within the NHS in your applications to show that you know the values, but still in an application, you're going to have to show you share the NHS values. So how can you do that? So I want you to think about how you, in your personal life, could show you share each of those values. So using this chat, pick a value and explain how you can demonstrate that value in your life. Think about your school life and your personal life. So if you're going to use compassion, write compassion and then tell me how you can show that in your school life. Now, some of you may be able to whiz through this quite quickly because you've done the pre-work. Those who haven't, have a little bit of a think about. Think about in your school life, in your personal life, how can you work together? How do you show that you work together for the best outcome? Listening to all people's opinions and their points of view. How do you show respect and dignity? Think about your schoolwork. Think about your classwork. Come on, the chat's being a bit lazy now. We need to get that going. Help me out. Those people who've commented before, those people who haven't commented, you're behind the screen, your mic's off, just have a go. Just have a guess. Even if you're putting keywords in, it helps other people. Okay. So respect and dignity. Have you in a time had to show that to classmates? People who maybe you volunteer, maybe you've got part-time work, people at home. Okay, let's see what's coming through. Thank you together. Really pleased to see that. So, Jen, I can only see part of your username. I'm just going to call you Jen for now. You've put working together, take views into consideration and find a way to make it all feel included and welcome. That's brilliant, Jen. Have you ever had an example in your life where you took everyone's opinion into consideration? Okay, Ruth, being a prefect or a monitor, brilliant. So Ruth, how would being a prefect or a monitor help you show one of those values? Put it in the chat, explain to me a little bit more how that helps you. So Leon, fantastic, supporting friends, caring for someone in the family, looking after pets. Leon gives a very famous example of a student who applied to show their NHS values by taking them through the story of taken on a rescue cat. So they were able to show by rescuing an animal, they had all of those values: compassion, working, respect and dignity. So you think outside the box, be creative. You could get it through sports, you can show examples through your classwork. Matthew, brilliant. So in your everyday life, you know, you're respecting people's answers and you're not laughing. You may have a time where you've had to show respect and dignity to someone because they haven't agreed with you. You know, or everyone counts. Maybe you're in a sports team and you're making sure everyone gets to play rather than just the people who are going to, you know, make it people who are going to win, basically making sure everyone is heard and understanding that people learn at different levels. Commitment to quality of care. You show a commitment to the quality every single day in school. If you get feedback from a teacher, you then look at that feedback and you use that to improve. Think about the time you've looked at something and tried to improve. Sharing, respecting other people's views, even if you don't agree, fantastic, Jen. So you're being compassionate to everyone's situations as they might not be in a good situation. There might be someone in your life who you show compassion to. You may care for someone. You may have a friend who's struggling, who you are confident for, and you show your compassion and you've done something to improve their life without being asked to do it because you're a compassionate person. Ruth, fantastic. Some schools, so you've expanded on that answer, really appreciate it. So some schools have anti-bullying ambassadors to show compassion and improving lives brilliantly. So you then, through your anti-bullying ambassador role, are looking out for other people. You're making a change in their life without being asked to. Fantastic. So what we're going to do, fantastic, Matthew, anti-bullying week. So what we're going to do, so we're just short on time, just to finish off. Now, can I just say, if any of you have got any questions about any of these values, please get in touch. I'll talk to you a little bit later on the end about how you can get in touch to follow up with any of these. So we've thought about what values are, how you can show your values within the NHS. Now, I want you to show me that you know what the values are really well through this last task. So I am going to show you a clip. It's about 3 minutes long, and it's an individual called Derek who's suffering with mental health issues. Now, he talks about how the mental health issues make him feel. So if you feel uncomfortable about hearing that kind of story, just put the volume on mute so you don't have to listen. But as you listen, I want you on the chat. You don't have to wait till the end. As you're watching, put in the chat, if you were a healthcare professional working in this situation with Derek, which of these values do you need to show to Derek personally? Show that you know those values, okay? So as you watch, put it in the chat. That's why I'd suggest you take a picture of the values so you've got them. So what I'm going to do is I'm just going to stop sharing and share this video. Just make sure my sound is shared. And there it is, okay. So can someone just give me a thumbs up? Your cameras are off. Someone just tell me they can see that full screen.
We can see it full screen, yeah.
Thank you, Leon. So as you watch, get that chat blazing. Tell me which of the values would you use to support Derek?
Imagine fainting spells, muscle spasms, twisting of the jaw, so much pressure on the teeth that they break right to the roots. Imagine grand mal seizures, fits of rage, confusion, migraines that make you feel as though your head is about to burst. Imagine hallucinating that you're on fire, pacing, rocking from side to side, slurred speech, blurred vision, vomiting after every meal. Imagine not going out all day, not sleeping at night, spending days in bed, feeling like a zombie, losing time and unable to think. Imagine a chip pan fire, resulting in third-degree burns to the hand because of loss of concentration. Imagine finding yourself walking down the motorway, facing the wrong way, wondering how you got there, being found in a muddy field with no memories of how you arrived there. Imagine smashing up your home, seeing all your furniture piled up outside your home, the police called. Being admitted to a mental hospital time after time. Imagine your mother, your lifelong partner, having to care for you. Imagine being 15, falling out of a tree, landing on your head, failing to recognise your own mother, being sectioned, ending up in a mental hospital. That's what happened to me. Then I have spent a lot of time in mental hospitals and in the mental health system. Medication affects you mentally, emotionally and physically. The side effects are horrendous. Now imagine a good CPN who spent time talking with me, asking me what I wanted, listening to the answers, giving me a voice, encouraging me to make a living will. Imagine finding solace and expressing my feelings through poetry and music, teaching martial arts and giving hope and courage to other sufferers of mental health. Imagine the good things can happen with faith, determination and the right support. Now I'm living free of medication and happy with my life.
Okay, so I'm just going to bring my screen back up and we'll go back to where we were up to. So thank you so much. I can see there's some very thoughtful answers in the chat there. So we had examples such as showing compassion, letting Derek know that you're there for him, giving him respect and dignity. We had showing you a supportive listener, and we had a great one there from okay, Jen, that was brilliant. Let him know that he's okay and he's not being judged. And Ruth, everybody counts, even with his difficulties, his preferences are just as important. So that is absolutely fantastic, showing that you've got an understanding there of the values. If you think about Derek's situation, working together for patients, he mentioned his mother and his life partner. It would involve working with those kinds of stakeholders. Respect and dignity. Listening to Derek, just as has been mentioned, giving him respect, dignity in a very difficult time. Everybody counts, just brilliantly, as Ruth said. People are at different stages. You need to make sure people need to be included. People need to be considered as they have different needs. Everybody counts. Commitment to quality of care. What's Derek's feedback? What does mum's feedback on the treatment he's getting? Listen to it and use it to improve. Compassion. Okay, are you doing things to help him without him even asking you? And of course, improving lives. Okay, so working towards improving Derek's life, but also the community's life. This video has been shared with a community. Derek's shared his story and we're sharing it with you to help improve the community's life. So that is it in a nutshell. And I thought that video was quite powerful to show to you, because obviously our volunteers today will work with patients with mental health issues, and they use their values in their jobs every day. So remember, NHS values based recruitment. Now, I'm going to very quickly just mention to this before we finish. At Creating Careers, we offer one-to-one mentoring support to support your pathway into a career within health and social care. So we can offer you one-to-one advice and guidance, right, about any NHS career. So we could ask, you could use the mentoring to ask about any of those values, or you could use the mentoring to develop those values, show that you're working together, show that you've got a commitment to quality of care because you're reflecting on feedback. So what I'd just like you to do, could you just answer this question? Are you interested in this mentoring option? Yes, not sure, no. If you just select your choice, and we'll go from there. Anyone who is interested, we'll put some details in the chat for you to get in touch with. So I am going to have to stop now because I'm going to get in trouble for running over on a jam-packed session. But so I'll stop sharing and we will hand over to our first interview.
Thanks, Leslie Ann. That was brilliant, and really, really good examples in the chat as well. I think I'm first up for interviewing, and I'll be chatting to Molly. If you want to pop your camera and unmute her.
Hello.
Hey, thank you so much for joining us. So I've got a couple of questions for you, and maybe the guys who are attending as well will want to pop some questions in the chat. Could you explain a little bit about your job title and what your job kind of generally entails?
Yeah, so I'm a dietitian, so I work for the NHS, so I work in a hospital, but that's not the only route that dietitians have to go down. So dietitians could work in education, in research, or in industry. But so I work for the NHS, so I work in a hospital. So what I basically do is I see very unwell patients. So it could be for a variety of reasons. A lot of the patients who I see are elderly. So I'm what they call a band 5 dietitian. So I've just started my first job as dietitian. So the patients I see typically present with a poor appetite, some weight loss, and they need support to help build them back up. So what I do is I will assess a patient. So I'll look at their weight, maybe a weight history. I'll see why is their intake poor. So talking to a patient is really important. So you might ask questions like, can you tell me why you think you might have lost weight? What are the reasons behind that? How much weight have you lost? Do you have symptoms that are contributing to your weight loss? So whether this be that the patient has been vomiting, have got diarrhea. So we have to look at all the different things that could affect intake. It could be that they don't have access to food, or they don't have care at home when they need it. So there's a range of different things. It might be that they've just had a stroke and they've got swallowing difficulties. So we work very closely with speech and language therapists, so they will assess a patient's swallow and make recommendations on textures which are safe for a patient to have. So if a patient's not eating much, we might place them on what we call a fortified diet. So what that essentially is we add, or the catering team will add skim milk powders to things like porridge, maybe soups or rice pudding. Adds a bit of extra energy and protein so that the patient is prevented from losing any weight and helps rebuild them back up. We might also provide them with supplements. So just like a protein shake provides energy, protein, and some micronutrients. So things like vitamins and minerals, which are important for our health. So we will quantify or estimate what a person is eating based off a food history. So these food histories are kept in the form of charts by the nurse. So we'll look at a 3-day period. We will then estimate what that patient is managing. We will then work out what the patient's requirements are and calculate a deficit. And from that deficit, so what energy or protein they're not achieving, we will then recommend, so maybe the fortified diet, maybe a few supplements depending on how big that deficit is. We might recommend extra snacks, but what we want to always do is make sure our care is patient focused. So we need to make sure that we're speaking to our patients, finding out what do they like, what don't they like, do they have any allergies, any intolerances. And again, obviously, if we're working closely with speech and language therapists, we need to make sure that if we're recommending supplements, that they are safe for the patient and they are of this specified texture. So a certain level of thickness that is safe for them to do so as well. We also, so for example, if a patient's had a stroke, some patients have to be fed via a tube. So this might be short-term or long-term. So short-term options can be a tube which goes in the nose and into the stomach, or even into the intestine. And like I say, so this might be if someone's not eating at all, they've got swallowing difficulties, and we will have to calculate the requirements and then calculate a feed. It's called a feed regime. So it might be that we feed them over so many hours. So that might be a continuous feed. So it might run for 20 hours throughout the day. Could be in the intensive care unit, which is usually 24 hours. Or it could be what's called bolusing. So for example, you might say how you eat breakfast, lunch and dinner. There'll be a bolus, so it's in it basically a syringe which might push feed down the tube at breakfast, lunch and dinner. So we will work around the management of that. We'll check the bloods to make sure that a person is not at risk of something called refeeding syndrome, which I won't go into too much detail, but it can put a patient's health at risk. So we have to carefully introduce the feed, and we'll monitor a patient regularly as well.
Wow, that sounds so interesting and so varied as well. You've mentioned quite a lot about working with the speech and language therapists. Are there any other kind of NHS professionals that you work closely with?
Yeah, so I mean, we work mainly a lot of the time is speech and language therapists, but we work very closely with doctors and nurses as well in particular. So for example, if there was maybe a decision that needed to be made whether to feed a patient via a tube, and the patient was saying, no, I don't want the tube, but they didn't have what is called capacity to make that decision, then what happens is we often have what's called a best interest meeting. So it might be a case of the dietitian, the consultant, a psychiatrist, and the family will gather together and talk about the pros and the cons, so the risks and the benefits of tube feeding for this patient, to enable the family to make an informed decision. So we have to communicate very clearly in medical notes as to our rationale and the risks and benefits with, say, refusal of supplements or taking supplements, to make sure that informed decisions can be made.
That's great, thank you. Would you be able to, because we've got a lot of students on the chat today, would you be able to describe kind of your pathway from maybe around year 9 all the way through to where you are now?
Yeah, so year 9, I can't quite remember what I was doing back at year 9, but when I was going on to do, I can say what I was doing from my A levels. So I knew that I always had an interest in nutrition. I never necessarily knew that I wanted to be a dietitian. I was also interested in science. I enjoyed biology and chemistry. Wasn't necessarily any good at chemistry, with all the math side of things, but I knew that it was something I was interested in. So for my A levels, unfortunately, they didn't offer where I studied nutrition. So I did biology, chemistry and English language. And I think to study dietetics at university, you need to do 2 sciences and 1 additional subject. I'm not sure what grades need to be because it depends on different universities. So if anyone wants to have a look at what grades would be required in the future, obviously look at university websites. And then I did my GCSEs, did my A levels, got my A levels, and I thought, I'm interested in nutrition. So I went and studied human nutrition. So that was to become a nutritionist. So with nutritionists, you don't work for the NHS, so you could work for a lot of companies, but I knew that I wanted to have a job where I was working with poorly people, because it's really rewarding. I actually got shadowing experience in a few hospitals actually, which I understand at the moment is quite difficult considering obviously the current pandemic. But I managed to shadow a few dietitians. One was at Clatbridge Oncology Centre, so people with cancer. And it was really interesting to see the benefit, the impact that dietitians can have with symptom management and preventing weight loss, which we know is really important to obviously promote quality of life and treatment outcomes as well. So I decided, you know, this is what I'm going to do. So I got on the dietetics course at the University of Chester, and then I did a placement. I've done 2 placements. So my first placement was at Merseycare, so that was in Liverpool community, so that was going out and visiting patients' homes. And then just recently I undertook a 16-week placement at East Cheshire NHS Trust, so that's Macclesfield Hospital. So that's where I got my job now, and that's what I'm doing now. So yeah.
Brilliant. So you got to do 2 degrees in the thing that you really enjoy.
Yeah.
If you kind of had to think one thing that you learned at school that you're still using now, so our students can kind of think about how their current learning applies, what would you probably say is still most useful?
I think for the area that I work in, I think biology is quite a key area in the sense of anatomy and understanding the reasoning behind everything that we're doing. Also, things crop up all the time, so something might come about chemistry and I think, oh, I did that years ago, I can't remember, and I might have to have a bit of a Google. But particularly anything to do with biology, you always think, oh, I don't need to know about that, or you know, but you surprise yourself when you do, and it's all building upon that knowledge. So it is really important that you pay attention when you're in school, because if you learn from it, you can build upon that knowledge, and that will help you progress in your career.
All that kind of broader contextual stuff that you think, oh, I did need to know.
Yeah.
So it's one last question from me before I hand over to our next interviewer. What is your favourite and least favourite bit of your job?
So I'd say my favourite part is just talking to the patients. So like I said, a lot of my patients are very elderly, and some of them are so sweet and lovely, and you feel like you're just going to have a chat with your nan or your granddad, and it is really lovely. And especially when they really appreciate your time and they remember your name. And I think that's what, when that, what you're doing is being valued. And obviously when things sort of work out in the sense where patients are maintaining the weight, and I had a newly diagnosed celiac patient recently, so they have to be on a gluten-free diet for life. And prior to this, because she wasn't adhering to a gluten-free diet, she was losing a lot of weight because her body wasn't absorbing the nutrients that she needed. And I was the first time I'd ever given advice about celiac to anyone. And since then, she's been able to gain weight. She's got a quality of life back, and she said she's so grateful. And I think just being able to have that impact on a person's life is obviously the most rewarding. I'd probably say the disadvantage, or the least favorite part of the job is obviously working in a hospital. There's always going to be sad parts where patients do pass away. And to be honest, to begin with, that took a while to get used to, and I won't lie. Those patients I saw and I'd find out they passed away, and it was very upsetting. Or if with dementia patients, a lot of the time the input you can have with them can be quite limited, just based off their presentation. They're very confused, and it's all good saying to someone you need to try and eat more, but if they can't retain the information as to why they need to eat more. So I've just seen a question here with losing weight. So particularly for elderly people, we want to maintain their weight to prevent risks of infections, increase frailty. So if they lose muscle mass, they might have falls, which can then lead to things like fractures in the hips. And there's association with that, with people passing away from that as well. Risks of sores that can form on the legs or the bottom. So there's a lot of reasons as to why we want to prevent patients from losing weight. But obviously, like I say, sometimes input is limited, and especially obviously when they are end of life, we have to withdraw dietetic care, because we don't want to provide them with sort of life-sustaining nutrition when their quality of life is poor. So that's a hard part. Can be hard to accept sometimes, because you always want to do the best for your patients. Yeah.
Absolutely. That patient that you helped sounds really rewarding. Lovely moment of the job.
Definitely.
Thank you so much.
Okay.
I have gone slightly over my slots. I'll hand over to Leon, who's going to do our next interview.
Thanks, Molly. Thanks, Sarah. Hi, everyone. It's been almost a year since I've spoken to our next speaker. So without further ado, can I call on for Carly, if possible, please? Hi, Carly. How are you?
Hello, can you hear me okay?
Yeah, great. Happy New Year. And
Fantastic.
like I
Happy
say,
New
it's just been
Year,
nearly a
everybody.
year.
It has, hasn't it? I know it flies.
So Molly's lined us up nicely because, as I say, she says she works hand in hand with yourself, or with you in terms of your profession.
Yeah.
So could you tell us more about who you are and what you do?
Yeah, well, so my name's Carly. So I'm a speech and language therapist. So my role is slightly different to what our dietitian was talking about, because she works with adults, whereas I work with children. And there might be some children with some quite complex needs that have difficulties with their swallow. So we would get involved with that, and the dietitians would help with their nutrition. But when you study a speech and language therapy degree, during your degree, you learn to work with both children and adults, and you'll do a bit of placement experience for both. And then you kind of decide where your interest is and where you might want your specialism to be. And then when it comes to applying for your first role, you'll generally be choosing whether that's with children or with adults. So my role is with children. So I work with the NHS. I'm based in a clinic, so like a big health centre. So just like you might go and visit your GP, I have like a little clinic room like that where families can come and see me. Or I might go out and do school visits and see children in school and work with some teachers there. Or we sometimes do little drop-ins where parents can say, oh, is there something to be concerned about? Do I need to refer them in? And you look at them a little bit closer. Or I can work with nurseries. So I'm generally more between the ages of about 2 up till kind of the end of primary. And I will be assessing their speech and language. So I'll be listening to, are there any sounds that they find it tricky to say? Are there any sounds that they're just missing out altogether in their speech, which makes it really hard for adults around them to understand? I might be working with children that stammer and working with them and parents to help support them so that they know a nice way to respond and how to react to that so that it doesn't worry them at all. And I might also be working with really little ones. Perhaps they're getting a little bit older and they're just not talking yet. They're not saying any words, or they're not starting to put words together into sentences. So kind of in a nutshell, that's how you'd perhaps work with children in my role.
Okay, so obviously part of our Google Classroom, we have a number of routeways in to the variety of HP professions. What did your routeway look like for you?
So mine was a little bit long-winded because I had no idea that speech therapy was a role. I think it's not very well known unless perhaps you've got a brother or sister that's had a bit of therapy, or you've had therapy, or you just know of somebody. So I, from college, did my A-levels I did like psychology and sociology. I knew I was interested in people and how they think and how they develop, and what happens if that doesn't kind of develop along typical lines, what might happen. So I did my first degree in psychology, and then had a little break and thought, not sure what to do with that. And then saw that my university ran a master's degree in speech and language therapy. So I did 3 years psychology and then kind of topped it up with a 2-year master's. But had I known that it was a profession and something that I was interested at your age, I could have just gone straight from A-levels into a speech and language therapy degree that's about 3.5 years. So I just went the long way around it.
So what GCSEs did you do?
So GCSEs, I did a full range. So we were a language school, so I did a couple of languages. I did all the typical sciences. I wasn't very strong in maths, and luckily I don't really need to use much of that in my profession. I did enjoy English, so I knew I liked words and how they come together, and just that general communication skills. I wouldn't have said that I was very sciencey, but it is quite a big component of the degree, but I'd say it's quite nicely balanced. So some of it is that science based, so a lot of kind of brain development and the functions, maybe some memory, the motor skills, how all of the muscles move together to do all of that talking. And then you've got your more kind of creative and language side of things, so the linguistics and the language and the Englishy side of things. So it's quite a nice balance of both, I think.
So in your typical day, you mentioned obviously the variety of different areas and different places that you go to visit your various patients. Do you work with like school nurses and so forth, and who else do you work with?
Yeah, so I work with school nurses. So anytime that we assess a child and then we see what's going on and where they need help, we make a little plan of what we're going to do and what we need parents to be doing at home with them, what we need school to be doing with them in the classroom. And then lots of people get a copy of that report. So it goes home, it goes to the school Senko, who's in charge of all the children in their school that have any kind of additional needs. It goes to the school nurse, perhaps. It might go to health visitors if they're very little. It might go to the GP if there's something a little bit complex there. And then I can choose to involve some other NHS services if I think it'll be beneficial. So if I think one of the reasons their speech isn't developing very well is because I don't think they're hearing very well. I think maybe there is some like wax on the ear, or when children are little, they can get bits of fluid or what we call glue ear. Then I might ask audiology to do a hearing test. So I can tick that that's done and say that is having an effect or it's not. Or if I have a look inside the mouth with my little torch, I might see that physically something looks a bit different with their tonsils or their tongue or the roof of their mouth. So then I can ask an ear, nose and throat doctor to have a look and see if there's anything that they need to be involved with as well.
Wow.
Yeah.
So, okay. If you could give any advice to the students interested today in your area, what would it be?
I'd say if you're starting to think that it's something you might be interested in, it's just all about any of that experience that you can be doing beforehand. So a lot of, by the time you're applying for a degree, some universities have interviews. So they might only have a set number of places and they'll interview some prospective students to see, just to talk through things like those NHS values. So how can you demonstrate that you're caring? How can you demonstrate that you're respectful? But I think just for your own benefit as well, it's such a broad area. That's just me working with children. But like the dietitian said, you can also work with adults with cancer or with dementia, or adults that have had a stroke and lost some of their language. So it's such a massive area. If you think that there's perhaps some charities that you know of that work with adults or work with children, where you could just have a little bit more of a look of the role of a speech therapist, or just to see, you know, do you like getting stuck in with little ones and playing games with them and having a giggle with little children, or do you like sitting with adults and listening to their life experiences? It can just help you give a little bit of direction of what you might want to do, and then it gives you loads to talk about then when you're applying for those positions. And things like charities, it's usually unpaid. So I worked with like rainbows and brownies and things, or there's like the charity Stammer that works with people that stammer. So have a look, charities are a good place to start.
That's brilliant, Kai, because as I say, you know, in terms of in-person experiences with health and social care, you know, we're nearly 2 years on, it's been so difficult.
Yeah,
one of my
it is
biggest
really
aspects in
tricky.
terms of promoting the variety of ways that you can gain experience and
Yeah,
demonstrate experience. And key to what Leslie Ann and everybody's mentioned today is about that values and demonstrating, you know, you don't
yeah,
necessarily have to have had experience in health and social care
yeah,
to demonstrate all those different elements that you've said there, you know, working with the
yeah,
family, talking to the brothers, sisters, cousins of that child that you're
exactly.
working with, and the
Yeah,
family members, the older members.
yeah,
It's multiple skilled, isn't it? And
absolutely. And just showing that passion and that interest, even attending things like today is, you know, you're showing that you're going out of your way to find out more about this because it's something that you're interested in. So that's all fantastic to mention.
what's your favourite and least favourite part of your role?
Favorite part is just getting to play games for a large part of my role. And I promise I am doing things whilst we're playing games. I'm thinking about how is this sounding? I have to, so through the degree, I've learned how to write speech as you're saying it, which sounds strange, but there's a way of writing it so that you can put in those little errors and things. And that's like learning a secret language that not many people know about. But you know, to do all of that chatting with children and to get all of that speech, you can just play lots of board games, lots of silly games, anything to kind of get them on your side and get them warmed up and feeling chatty. So I do get to do lots of fun stuff with little ones, which is good. Least favorite is probably the waiting list, just knowing that there's, you know, whatever good work you're currently doing with those children, there's thousands of children that are waiting for that input, more so since COVID and since children have missed out on school time and things, which is why we would really love to keep recruiting people as speech and language therapists, because you're so needed right now to help those children catch up.
So you get paid to be a big kid, so I like that.
Yeah, I've always got sort of bubbles in my bag or little kind of those little mini tabletop games and stuff. And to people watching on the outside, it does just look like you're having a good play.
You're getting loads and loads of questions in the chat. So
Yeah, no
after I
problem.
finish my last question, if that's okay, we'll answer them in the chat, because we'll have Katerina hopefully shortly moving on. But
yeah,
what skills or knowledge did you learn in school that you still use today?
I'd say definitely around teamwork. I know that is a big focus around school, and perhaps you're not always sure of why that is, but it is so important. I think once you're within kind of like the family of the NHS, you do rely so much on each other. But I really like the fact that it means that it's really non-competitive. You don't feel like you're competing with your colleagues. You're all one big team. So just being able to be open with people and ask about their experiences. What have you find that's been really helpful, or what was your experience of working with this child, because I've got a similar one and I think you could be helpful. And then like doing the same, sharing your experiences. Oh, I read this article that suggested we could try this. Let's do that as a team and see if that's helpful for children. So yeah, definitely being open in your experiences and being able to listen to other people's and ask for other people's opinions as well.
I know it's being asked in the chat in the last one. Where did you study? What university did you go to?
I went to Manchester Metropolitan for both, for the undergraduate and the masters.
Brilliant, thanks. And as I say, there are a number of questions in the chat. So if you could stay with us for the next 10, 15 minutes just to
no
answer those, that'd be amazing. It's absolutely a pleasure. I know it's a whirlwind 1 hour, and I know that we've had longer in the past, and hopefully we will in the future. But I'm really, really mindful, obviously, with pressures and so forth, and really appreciate your time that you've given it for us this evening. Thanks again, Carly, and I'll no doubt speak to you again, because you're just absolutely amazing.
Do you want me to answer these in the chat now?
If that's okay, please.
Of course,
yes.
No problem.
Yeah,
I'll pop my camera off and let the next person go. Thank you.
Fantastic. Leslie Ann, are you there?
I am.
There we go. So I'm going to sign off, and then you have the last but not least.
So yeah, indeed, last but not least, we're going to look at drama therapy now. So is Katrina about? She's on the call.
was a little bit worried because she did say she was coming on a little bit later. So I don't know if she is on.
Okay, well, we've got plenty of questions from for Carly for speech and language. I wonder if Carly wants to pop back on and you can answer a few of those more questions while we're waiting for Katrina. And if she doesn't come on, if anyone's got any questions about drama therapy, you can send them through to us and we will get them answered. Apologies for that.
No problem. Let me just scroll back.
Thank you for saving the day, Carly.
No worries.
Hugely appreciate it. I think if we start, oh, you've got.
And Molly may be still here as well, hopefully.
I'm glad that people have questions. Yeah, no, but just give me a nudge. Just tell me to hop off when she arrives.
So if we can start with, we've got a question. Is there a lot of competition to be a speech and language therapist?
So it used to be the case that yes. So when I was graduating, there was quite a lot of competition. I think it depends where in the country you want to work. So I wanted to stay in Manchester and that was quite competitive. However, other people on my course kind of went home to various places around the country and got their first post quite quickly. However, now we are quite in demand. So I think it's actually a really good time to get into the profession. And I know that universities are kind of opening up how many people are able to be on each course. So for my masters, it was the first time that Manchester Met had ran the masters. So there was only 13 of us, whereas now I know they're accepting lots more. So it used to be very competitive, but now we're really needed. So hopefully it's much easier for you all.
Brilliant, thank you so much. Just a reminder, if you've got any drama therapy questions, put them in the chat and we will get them answered for you after today's session. Well, thank you for filling in, Carly. And of course, Molly is still here as well to ask any questions about dietetics. Molly, if you would you mind just coming on a moment and we'll ask. I thank you so much for it's a good opportunity to get a little bit deeper into both of the roles and go through all those questions. But just I'm just interested in, you know, from the dietitian role, is it possible to work in lots of different settings or is it mainly hospital based?
Yeah, so it doesn't have to be in the hospital. So there's many companies that might specialize in, say, like weight management, and people might have their own like clinics and stuff like that as well. Again, like education. So for example, you don't have to be a dietitian, you could only be a nutritionist, but you could work for, say, a football team who need coaching on certain nutrition advice. Also, so various private practices, so you could practice privately. Some people set up their own businesses as well as dietitians. The media, research, like I say, some dietitians work for a company that specialises in gluten-free products. It's called Dr. Shaw, so they will work very closely on sort of the product formulation side of that as well. So there's a lot of avenues you can go obviously into. If you didn't want to work for the NHS, or even if you did it for a short time and thought this is not for me at all, you can move around a lot of areas, or you could specialize in areas. So you could work in pediatrics, or you could be what's called a gastro dietitian, so anything to do with the gastrointestinal tract, so anything like that. You could work in the intensive care unit. So there's a lot of avenues that you can go down. And I think that's why the job is so great, because I think when you pick sort of what you're going to study at university, you think, oh gosh, am I going to have to do this for the rest of my life, in the sense that I can't change my mind. Whereas doing dietetics as a degree actually allows you to consider a lot of different options and different opportunities that you want to explore. So yeah.
Well, I was actually, funnily enough, at Anfield Stadium not long ago, because we were booking one of the rooms for an event, and we actually met the dietitian for the first team. So there just seemed to be, there's lots of, you know, many avenues you can pursue for that kind of
there is,
course and things. So the question for you both really was, Carly, we'll start with you and then back to Molly. Students are asking about work-life balance. Do you find in Carly in speech and language therapy, do you find there's a reasonable work-life balance?
Yeah, I really think there is. Yeah. And I think that perhaps that's only something you start thinking about as you get a little bit older, because when you're younger, you've got all the time in the world and fewer responsibilities. So you might just really love to throw yourself into work, which is absolutely fine. Like I say, if you're working with adults, you might be working in more of a hospital setting. So I'm less sure whether they would have the same set hours or whether you would be rotated similar to nurses and doctors. But certainly for my role within the clinic and within schools, I just work kind of 9 to 5 hours, Monday to Friday. If we do decide as a team to offer something extra like an evening clinic or a Saturday morning clinic, that would be paid overtime. Lots of us like to prepare resources and games and things at home, but you're absolutely not expected to bring work home. It's not like if you're a teacher and you had to bring marking home. So you can absolutely finish your work day and go home, and you don't have to deal with anything until you go in the next day. And currently I'm doing a lot of remote therapy over video as well. So we're not fully back into the office yet, but it's actually opened up this whole world of doing therapy remotely over video, where actually I can see more children because I'm not having to do any travel time, and neither are they. So that's actually been quite beneficial.
Brilliant. It's really great to see young people asking about things like work-life balance, because it's so important. And
Really
like you
is.
say, you don't realise till you start a job how crucial it is.
Yeah.
So Molly, from your point of view, how do you find it?
Yeah, so very similar. We have I work 5 days a week. We have flexible working hours, so I can either work 8 till 4, 9 till 5, or 10 till 6. We don't work weekends, we don't work nights, we don't work bank holidays. So yeah, it's good in terms of that. I actually work away from home, which is about an hour and a half drive. So for me, the work-life balance at the moment isn't great, but that's only because I'm working away from home. But because of that flexible working hours, if I have a clinic, which I forgot to mention, I also do a clinic every other Monday, but someone else is doing it at the moment for us. If I have a clinic, I can work from home. It's all telephone at the moment with COVID. So it's really flexible, and I work in quite a small hospital, so the caseload isn't huge, which means obviously I'm able to manage my time quite well. I'm not stressed. So, and I think that was one of the key things for me. I'm a bit of a stress head, to be honest. So I've always said, don't want a stressful job. I want a job that I love and gives me the flexibility, and that's exactly what I've got.
Brilliant. And just because you mentioned location there, just while we're on the topic, for students, obviously this is students from across the Northwest watching.
Yes.
If a student in the Northwest is interested in this particular field, are there lots of opportunities within the Northwest, or would they realistically be having to think about moving to elsewhere in the country?
No, there is so many. We have a shortage of dietitians at the moment. So the more people that get into dietetics, the better. It's just I actually got my job still in the Northwest, but a bit away from home, just purely because I did my placement there and I loved it. But I am looking for a job closer to home. But like I say, hundreds of job opportunities come up all the time, especially in Liverpool. So there's always jobs going, and obviously once someone progresses from band 5 to band 6, then that band 5 position becomes available and they'll be hiring, so they'll be looking for someone to fill that post. So yeah.
Brilliant. Thank you. And Carly, one last one for you. Thank you, because we're just approaching 1:30. So Matthew is interested in, as a speech and language therapist, can you work with both children and adults? I'm assuming he means at the same time, or do you have to specialise?
So nowadays you do tend to specialise. So they used to do what was called split posts, but it does tend to be one or the other now. I think, again, that's why I like the option of working with children, because then within that you do just end up working with adults as well, maybe not to do therapy, but sometimes I do one-to-one therapy sessions that's just the parent, because it might be around stammering, for example, and how they feel about stammering and how they feel about their child stammering and possibly continue to stammer. So sometimes there is opportunity for therapy sessions with parents. And then we also do things like training for groups of parents or groups of teachers. So actually, even though my role is primarily with children, I get to work with both. But it's a shame that those kind of split posts don't tend to exist anymore to do therapy with both.
Brilliant. So thank you so much, both of you. I really hugely appreciate it, especially stepping in and answering a few more questions. She worked out quite well because we could get a little bit deeper into both of your roles. And students, huge apologies that we weren't able to bring drama therapy to you today. It's the perils of working live and via Zoom, all kinds of technical issues. But we will make sure that we get a follow-up interview done. So if you have any questions, please send them in either on the chat now or post them on the Google Classroom, or I will put an email address in the chat for you to send anything in. Any follow-up questions about either of the speech and language therapy or the dietitian role as well. So I will hand over. I think there's just a few closing statements that Sarah wants to finish off with, and we'll go from there.
Closing statements make them sound very grand.
Well, we are grand at creating careers.
Just a little overview of what's going to happen next for you guys. This is recorded. It'll go on the Creating Careers YouTube channel that Leslie Ann looks after. So if you wanted to watch it back, think more in depth, you'll be able to do that. You're also going to get a follow-up email from Abby tonight with a little bit of a post-work roadmap. Again, Leslie Ann's put that together. It follows on really nicely from the pre-work that you've already done and the session you did at the start, and it really helps you consider the different careers, and when you come to applications, everything else, to have a look back and make sure you've logged all these experiences. You'll also get a short evaluation form, and that'll just be a link in the email. It'll take you less than 5 minutes, and it just helps us to know what you enjoyed about today and what you'd like future events to involve. On that evaluation form, the very bottom question is an opportunity for you to request a one-to-one follow-up. So that is myself or a member of the Uni Connect for your area. So if you live in Greater Manchester, it'll be one of the Greater Manchester Hire staff to get in touch and speak specifically to you about your aspirations, what you're really interested in, any questions you've got that are very specific to yourself. So we really, really do encourage you to take that up. We will do it in whatever way suits you. I've already mentioned the Google Classroom, but I'm going to harp on about it again. You will all be added to it, so please just click the link through, spend a bit of time on it. There's a Padlet on there with loads of information, and you can ask additional questions as well. If we don't know the answer, we will go and get it for you. And just to remind you that this webinar is not a standalone, it is one.
We've lost your sound, Sarah.
Like you already know and you can do it because you signed up for today. But even if you think, oh, I don't think I'd like to do that career, but I would be interested in it, or I think that the career I would like to do might have something to do with them, they might work together, come along, attend. It's only an hour, and it'll be really useful for you, and you're able to speak a bit more broadly when you get to university, apprenticeship, or job interviews about the wider NHS. And that is everything from me. Those are my closing remarks. So thank you guys so much for attending. We hope you have a really lovely rest of the evening, and we'll hopefully see you at a future webinar.